All right, great. I'm going to go ahead and just share my screen and we'll go through the agenda, and then I'll turn it over to Tom and then our presenter for our July call. So thanks for everybody for joining. Hope everybody's summer is going well and you're handling the heat somewhat okay. So we have a couple of telehealth policy updates that I will send out in the meeting notes so you can take a look through. The other thing I wanted to just flag is our Rural Health Champion nomination and Telehealth Innovator nominations are due to, and I put the links in both to the chat. These are for our North Country Leadership Summit that's being held September 24th and 25th. The Adirondack Rural Health Network is looking for nominations for a Rural Health Champion. Awardees are individuals who've showed exemplary selflessness and leadership in their work and must be an individual delivering outstanding care in Clinton, Essex, Franklin, Fulton, Hamilton, Warren, or Washington County. So if you know somebody or want to nominate an individual, I have the link in the chat. And then as far as the Telehealth Innovator Awards, we're looking for someone who has created an innovative program or application of telehealth, which has led to improved health outcomes in the community and/or improved quality of life. Awardees will be considered from Clinton, Essex, Franklin, Fulton, Hamilton, Jefferson, Lewis, Warren, Washington, Saratoga, or St. Lawrence County. So again, if you're interested in applying, that due date is coming up. We're probably looking at July 31st for a deadline for that. Okay, so I'm going to turn it over to Tom, and he's going to talk a little bit about some of the resources that he has and has been using with his relationship with PowerShare. So I'm going to turn it over to you, Tom, to give us a little intro.
Yeah, absolutely. I'm gonna share my screen real quick here. Hopefully everybody can see that okay. So we had an interesting kind of experience. We had a scenario where data sharing was really happening as far as patient medical records, but we were certainly still running into the issue of lacking sharing of medical images. So we kind of got into the realm of medical imaging got kind of left behind as technology.
All right, I think we lost Tom.
Can you hear me?
I could hear him. This is Byron.
Can you hear me? Hello, 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 hello.
Yes, I can hear you, Tom.
Okay, so Byron can hear me.
Yep.
Joanna can hear me as well. Okay, well, I'm going to kick back. I'm not sure whether. Yeah, okay, so I am going to continue here. Go back to sharing. And can everybody see my content as well, my screen that I was sharing?
Yes.
Perfect. Okay, yeah. All right. So so essentially we got into kind of a situation that we noticed. We're doing a great job sharing medical information, but kind of medical imaging kind of got left in the background. So this is kind of just something quickly titled, how medical technology left behind medical imaging. So, and we accomplish this with PowerShare. Byron's on from PowerShare, so he's going to be doing kind of more of a deep dive. I'm just kind of giving a quick overview of how we partner with PowerShare in order to make sharing these medical images happen. So real quick, I'm sure that Byron's going to cover this, during his presentation, but there's just some technical terminology. I know not everybody is familiar, with, as far as the technical medical terms when it comes to radiology and radiology systems. So you'll hear references called modalities. Essentially, if you hear something referenced as a modality, it's just a medical imaging device such as an X-ray, CT scanner, mammography, etc. So it's a medical device, takes an image, and then processes that up. So we just refer to those as modalities. PAC systems. So you hear PAC system, and essentially this is the aspect of an EHR that handles your picture archiving and communication. So that's where you hear the term PACS. Some of them are standalone systems, and some of them are actually integrated into your EHRs, your medical record systems. There's various ones out there, but when we hear PACS, that's kind of what we're talking about, is that specific module when it comes to handling your medical images. You'll hear references about comparisons. So we really got into this because when somebody comes into a doctor's office and if they're being treated with something chronic or even sometimes acute, if there's medical imaging done, the medical provider a lot of times wants to look at a comparison image. So a image, for example, if it was a chest X-ray, they want to compare what happened 6 months ago or a year ago because they want to understand, has the disease process changed or has something else developed? Have they improved? So a lot of times, in order for them to make the determination, they actually want to look at comparison imaging from previous studies that these patients have had. Comparisons can be extremely important, especially during emergency treatment. Somebody already has some types of venous disease or whatever. Having that comparison is extremely important to kind of help determine, is this new, is this something acute going on, etc. And then HIE is the Health Information Exchange. I know many of us utilize this. And there's many of them out there. We use Healthy Connections, but there's a whole bunch of them out there. And then diagnostic quality. So not only do we look at these medical images, there are certain standards that are required in order to view these images and to be able to use them for diagnostic imaging. So when a radiologist actually looks at a monitor or screen, there are certain quality measures that go into place in order to be of high enough and accurate quality to make a diagnosis from. So that's just a couple key terms that we're going to talk about, or that I just want to cover briefly. That way, nobody likes to ask detailed questions if they don't understand something. So I try to get some of the more technical stuff kind of out in the open. And if I do use a term or something that is not, that isn't familiar, please feel free to either ask myself or Byron. Byron's a wealth of knowledge as well. So everybody kind of remembers this area, and this is where we were for a long time. The era of physical film. So you got actually got an image, was developed like the old 35 millimeter. And a lot of times those went from doctor's office to doctor's office or doctor's office to specialist. Either we sent them with a patient or we may have sent them with a courier. So that was an era of physical film. Everybody kind of familiar with that. Everybody kind of saw that. We didn't really change the process a whole lot when we got into the era of digital. We still were trying to move images around, and we were still using physical type media. It may have been digital, but we're still moving physical media. The main issue with that is we were digital. However, the size of these images was a hurdle and a challenge that we had across. Some of these medical imaging were enormous in size, and to transmit over the internet and the networking requirements were definitely a challenge. So we still put those medical images that were digital on physical media and move them from doctor's office. What we got into though is one doctor's office or hospital or wherever would put those images on a CD or DVD, send it to the patient. They would go all the way to their doctor's office for their appointment. They would give it to the doctor or the receptionist during check-in. They would try to load it up for that specific patient, and there was some sort of compatibility issue. They couldn't open the files, and that was beginning to happen a lot. So that it started causing patient care delays. You schedule an appointment for a specialist. You bring your imaging with you because you've been referred by your primary care, and then they can't look at these imaging, and it puts the specialist potentially in a tough spot when they can't see your imaging. So now they either need to require them or you need to get another copy. So that was actually happening a lot, and we got this information kind of from our region that this was actually happening a fairly recent. So we move on to kind of the health information exchange era. So this is great. Both their medical records and imaging was going up to some of the HIEs. But the one thing is we were all tied. To. Sorry, it's all my phones ring here. We were tied to the consent model, which means if a patient didn't consent with either their primary care or the hospital systems, they didn't consent, we couldn't utilize that. The only time we could potentially utilize that if it was an emergency situation. So if they presented in an emergency room, or if it was an emergency situation where it was life or death potentially, we could use what was called a break the glass incident, and we could potentially grab that information, including imaging, without consent for the patient. So medical records still kind of remain siloed, with consent models, but also siloed with across regional HIEs. saw a provider in a different region with a different HIE, that data did not always cross over. So we still weren't at the point of the national sharing model. There are efforts underway. There are still limitations right now, but they're actually working right now to try to get this more of a national model rather than the siloed regional models. So we got into the realm of Nuance PowerShare was actually kind of being used by a lot of facilities already. However, without a actual agreement in place, Hospital A knew that the patient had been seen at Hospital B. They had to send a request through PowerShare. It had to be reviewed by somebody in their imaging department. They had to look at those, get approval, and then actually approve those images, and they would send them digitally back to Hospital A. So it was still a manual process to a sense. Still had to get it, still had to select the right images, had to get the approval, and then send them across. So weren't moving physical files anymore. We didn't have kind of a formatting or an access issue with different formats and stuff, but there still required human intervention. So that's kind of where we were at for a long time. We worked kind of in conjunction with PowerShare and our different hospitals to sign what's called a cooperative agreement. So because everybody is a covered entity, we don't necessarily have to have business associates agreement. That's covered under 45 CFR. So the nice thing is with PowerShare, they're just kind of the software in between. So as long as there's agreement between facilities to openly share their medical imaging with other hospitals, that can happen automatically. So we signed, or not necessarily we, but a lot of these hospitals signed this cooperative agreement, which means Hospital A, if they had a patient, they could openly query their imaging records, and if there was something that they needed, they could automatically pull it down without any human intervention. And that is the key. A lot of times at the point of care, if they were missing something, they could quickly go in and potentially grab that. If there was an emergency situation, they could go in and grab it. The nice thing is we improve patient care. They got the imaging to make the best medical decision at the time. We reduced care delays, right? So we didn't have to reschedule appointments, didn't have to regather imaging because they weren't available or wasn't working correctly. And ultimately, we enhanced the patient experience. We didn't have to have them come back for an extra patient visit that they didn't necessarily need to. So basically, this is kind of the timeline that we did. The original idea actually came up from patient-driven data and experiences, and then it got shared with us to kind of help facilitate. Work group was formed roughly in 23. From there, we kind of identified the participants and identified different people that we needed to engage into this. So once we did that, we started facilitating a work group and then kind of reviewing some goals and challenges that we wanted to get to. We drafted our agreements, had it reviewed by legal, and the agreement went roughly into effect about Q2 to Q3 2024. And then since then, we've shared over 10,000 images. So we've definitely had a positive outcome, not only from patients, but also providers, because they can get that imaging when they need it. So that's kind of a summary on how we did this. And I'm going to stop my screen and kick this over to Byron. And hopefully I didn't steal too much of his show here, because he's got a whole bunch of other good information as well, I'm sure.
All right. Well, thank you very much for that, Tom. So just to introduce myself, my name is Byron Kelley. I'm a PowerShare customer success executive. I work for Microsoft. We used to be called Nuance. We were acquired by Microsoft a couple years ago, so now we're officially part of Microsoft. But I'm going to give a brief presentation or overview of PowerShare, and then I'm going to show you guys a demo of the actual application. I'm more of a hands-on learner, so it's nice to actually see the application. Let me share my screen and not my video. Let's see. All right. Can you guys see my screen?
Yep, we can see it.
Okay. Good deal. Let me see. There we go. Okay. Put this in presentation mode. Bear with me 1 minute. All right. So PowerShare is an electronic image exchange solution. I'm just going to give you guys a brief overview of the application. PowerShare is currently used and trusted by thousands of healthcare facilities around the nation and the world. And I'll share how this solution can help drive efficiencies, improve patient care, and also lay the foundation for enterprise AI and imaging. I'm not sure if that's applicable, but I'll touch on that for sure. So PowerShare, here we go. So the image sharing network with PowerShare, we have over 50% of the hospitals within the United States are on PowerShare. We have over 150,000 active patient accounts and over 40,000 physician accounts. And what I mean by that is when you set up an account on PowerShare, it's primarily used for facilities or hospitals. But we're seeing a big adoption with patient sharing and also physician practice sharing. So there are different accounts based on facility, patient, and provider level. The vast majority are facility levels, hospitals, law firms, chiropractic offices, dental practices. There's all sorts of different organizations. Whoever has a need to view DICOM imaging, we can have them set up on PowerShare. All right. Sorry, okay. So we have currently over 80% of the hospitals in the US are on PowerShare as of March 2025. 50% or more facilities in each state across the US use PowerShare. So my area of responsibility, I cover Indiana, Ohio, up through New England, and of course, your region up in New York. So I've worked primarily with Samaritan Health, Claxton Hepburn, the North Country sites. That's where this all came about, at least for my involvement. And what we did is we set up different PowerShare accounts for those facilities. And as Tom had mentioned, we actually gave query retrieve permissions, or the sites, the actual facilities signed off on this, so that they could, once they're connected on the PowerShare network, they could actually go in and query retrieve or pull images on demand from the respective sites to help speed up the patient's continuum of care and efficiency process. And that way, patients were able to have their images sent or pulled on demand to the different sites within the North Country region. So it's a really, honestly, a pretty unique setup, but it's worked out really well, and we've had some good results there. All right. So PowerShare, I'm not sure if you guys are familiar with the class scoring system, but PowerShare has earned #1 in class sharing for the past 3 years in a row. Lots of good success here. It's an award that's given for vendors who have scored highly with customer satisfaction. So the main focus from my perspective and our perspective is patient satisfaction. So of course we're trying to assist your organizations with the image exchange process, and patients having access to their images, and facilities and providers having access to help with that continuum of care to ensure good quality outcomes are met for your organization. All right, so PowerShare, it's built off of what we call the hub and spoke model. So a hub is the terminology we use for paying PowerShare customers. And then we set them up with other sites, which we call spokes. Those are the free accounts. So it's an organic model. So for example, I like to use Samaritan Health because they were one of my first hub accounts in this region. So if they had a need to connect to Claxton Hepburn or Lawrence General, a site that wasn't yet on PowerShare, we would reach out to that site, set them up with a free account, which we call a spoke, connect it to the hub, and then the spokes can exchange with the hubs and the hubs with the spokes. And it's utilizing the volumes of the hub accounts, but it's a good way to grow the network. And then of course, as sites use the product more and they're seeing more positive results and adoptions. Other sites can upgrade to become a hub account. But that's what we mean by when we use the term hub and spoke. So they can start sharing for free immediately, and then the hub accounts, they're growing their connections, improving outcomes, helping eliminate that physical media, the CD exchange, because there's a big need there, going forward to have an electronic exchange network. And I fall under the outreach services, so a CSE or customer success. So I help with the relationship management, establishing those connections, growing the network, and helping. The big key here is to help eliminate the need for CDs. Of course, you still will have patients that request physical media, but we really have driven adoption to set up patient accounts, connect them to the PowerShare hub accounts for the facilities, and that way it's a seamless integration to exchange images electronically. And of course, we are vendor agnostic and a trusted partner, so there's not a need for BAAs to be signed for each connection, because once you're on the network, those are already in place, and it just helps speed up things from a compliance perspective. All right, so this is just a nice visual representation of the PowerShare journey. So step one is you start sharing at no cost. Like I stated, you can become a spoke account. That's typically initiated on behalf of a hub. They reach out to me to set up the site or the facility to connect. Then we try to eliminate the CDs through that electronic image exchange platform. We improve workflows, so we deploy automation to improve efficiency for the staff handling outbound and incoming images. We also have technical components which can auto share images. We can integrate with modality work lists. We have additional features that can automate orders. It's called auto order generation. We can also integrate into EMRs. Primarily Epic is our big partner for implementing implementing within the Epic environment. And then once the facility to facility connections are established, we really start driving the patient engagement. So yes, you can exchange and send images to other hospitals or imaging facilities, but patients can also create their own accounts. So images can be sent to their dedicated patient account. And then patients, are empowered and have access to their images. Instead of having a CD on hand, they can just log into their patient account and access their medical images at any point in time. And then they can actually take their patient account and connect with providers or other hospital facilities, as they go to different appointments. It's just a good network per se to exchange electronically. And we are multi-domain, so there's enterprise-wide solution, includes other facilities like law firms, vendors, chiropractic offices, dentists. So I have seen a lot of adoption over the past several years outside of the hospital setting. So any site that has a need for DICOM, it's an electronic image format, we can set them up on PowerShare and get them connected. And since we are image aware, the point of care access, image access without delay or reliance on another party, and we can use cross-site query PowerShare APIs, which is what is happening in the North Country. The query retrieving that I was referring to, we call that cross-site query. So the users have been trained on this. They can log into PowerShare, and if they need studies from Hospital B, and they're part of Hospital A, they can simply log in and pull the images to their PowerShare account without having to, pick up the phone and call or send a fax request. That's how we've set this up with the North Country sites, and it's really improved the process, especially from a resource perspective, not having to have file room staff constantly manage this workflow on a daily basis. So that's been a big improvement there, at least from my experience working with the different partner sites. All right. And here's just a case study of the Indiana Health Information Exchange. I included this because it's similar. It mimics what's happening in the North Country. So the Indiana Health Information Exchange, they have something similar set up where I believe they have 6 or 7 different sites within the state of Indiana that have connected and signed agreements, just like a lot of your sites have up in New York. Very similar process. They can, it removes the barriers to streamline image sharing and accelerates patient care using PowerShare. And once again, this eliminates the need for support staff having to place those requests either through fax, phone call. It's a more seamless integration to ensure a smooth patient continuum of care process. All right. So once we create a PowerShare account, there's helpful information on the application. We call them onboarding modules. So we've put everything as more of a self-service module within the application. And I'll dive into that more when I show you the actual application. But there's helpful tools, onboarding modules that acclimate staff on how to use the application. It takes about an hour to go through these modules, but it's good for new users of PowerShare or people who haven't used the application and are new to it. Gives them an overview of how to use it and how to become more familiar with the application. Of course, part of my role is if a customer is logged in or they need assistance with PowerShare, I'm happy to jump on a training session or make sure they get the tools needed to use the application successfully. So we also have within the application real-time and relevant information for analytics. So once you're in PowerShare, you can see who you're connected to, who's driving that volume. There's a HIPAA audit trail. So if you needed to audit actions occurring within the application from a compliance perspective. So actions are tracked up to 3 years. So if you needed to see, who was sending images of what patients, that is captured within PowerShare, and that's a helpful tool from a compliance and auditing perspective. All right, so PowerShare has two components. You have the web-based application, which is accessible via a URL, www.nuancepowershare.com. Users can be granted access with their email address and a unique password. We also have the accelerator software, which is the DICOM router. So this is what helps bridge the gap from PACS, which is a picture archiving system. So you have your images, or most sites have images stored in a PACS, and then PowerShare acts as like the middleman there, but it helps bring everyone together. The accelerator software allows DICOM transfers to flow into the PowerShare network, and then once images are received, it can also flow the other direction into your PACS. So you can send images from your PACS through the accelerator to different connections on PowerShare. And then once you receive images from those connections, it works the other way. So it's bidirectional. So you can send and receive through this accelerator software. And most sites opt to install that accelerator software, such as all the North Country sites. It's included as part of a PowerShare subscription. All right. All right, so I'm just going to briefly touch on some more things regarding to PowerShare image sharing. So we have something called the inter-facility exchange. That is what most customers are familiar with, where you can connect with different sites, request images, share those images as needed to the different hospital facilities. We have all sorts of rules we can put in place, such as sending directly from PACS. Once images hit your PowerShare account, they can actually automatically flow into your PACS as well. So that's what we mean by inter-facility exchange. The big adoption that I'm seeing recently is the patient sharing. So as I had previously mentioned, we can set up patient accounts, connect them to the different sites. And once patients have their own dedicated account, they can then take their images, connect with providers, facilities, and they can actually download the images if they want to. It's just a good central repository so patients don't have to keep up with physical media. We also have physician accounts as well. So if a physician, physicians can be added to facility accounts as users, but a lot of times physicians have admitting privileges, multiple hospitals or multiple organizations. So they can actually have their own dedicated physician account. And it's similar to a patient account, but it's just for the physician. So the physician can get images from their respective patients, and it empowers them to have access to those different images. And they don't necessarily have to be a part of the specific organization. So, you know, I don't see as many patients, or I'm sorry, I don't see as many physicians having their own personal accounts. A lot of times they're part of a larger facility account, but it is an option out there. And I do have, several physicians that prefer this as well. Then another section, of course, is my role, which is a customer success executive. So my big goal, or my job, is to help connect the different sites with other sites, patients, providers, assist with workflow, training, just to make sure users are acclimated on the application and help grow and expand their network. So as a hub account, a paying PowerShare customer, they get a dedicated customer success executive, and I establish, or I work on their outreach, and I'm really their easy button, as they call it. So they reach out to me for questions, setting up connections, training, onboarding, that kind of administrative tasks, and it's a good benefit to lots of our hub customers. And then we also have additional add-on features with PowerShare. I'd mentioned auto order generation. We can also integrate with EMRs. Smart on Fire is the new standard, and that's primarily through the Epic EMR. But patients, we can actually integrate with the Epic MyChart portal. So patients can log into their Epic MyChart, and actually it's integrated into PowerShare, so they can stay within their Epic instance and still have access to their images within PowerShare. That's a new feature that's seeing a lot of growth recently. Then also, I'm not sure if you guys are familiar with PowerScribe. That's another one of our products, but we integrate with the PowerScribe reporting functions as well. So reports can flow within PowerShare with the images. We can integrate with third-party HL7 feeds, but it's a free, it's included for free if you're a PowerScribe and PowerShare customer. Then, of course, this is based on the licensing model. There we go. So so I'm not on the sales team, but PowerShare is a subscription model. So you agree to an annual subscription, and that's what your monthly fee is based on upload volumes. And of course, you can, as you grow, you right size your contract, but there's lots of adoption and growth there. And of course, we provide cost breakdowns. I think the estimate was between $5 and $10 per CD that you're using if you're still using CDs. So the cost savings there, with PowerShare, it may be roughly $3 per study. So there's a good business justification there. But with our licensing model, we provide those hub models on an annual subscription, and that's how that's our business model. But that's just a brief overview of PowerShare. I want to get into the actual application. Like I said, I'm more hands-on. So this is my demo account. So as I had previously mentioned, PowerShare has two components. You have the web-based portion and the accelerator. So when you log into PowerShare, we set up an account for you. This is what the users see. You have the home tab, contacts. This is where you make your connections. So if you guys are familiar with social media, Facebook, LinkedIn, this is a very similar feel. So on my demo account here, I'm connected to all these different sites across the United States.
Hey, Byron, sorry, just as Jennifer, I just wanted to pause you real quick. I don't have a share screen on my end.
You don't have a share screen? Okay, hold on. Let me see. Can you see it now?
There we go. Yep.
Okay,
Thank you.
sorry about that.
No worries.
Yes, so this is the PowerShare web application. You log in via your username and your password, and this is all cloud-based in the Azure environment. So when users log in, you have your home tab, your contacts tab. That's that Facebook social media feel here. all your connections are listed. And as you make connections, you simply click add new contact. You can search for a facility. Let's just use Mass General Brigham. They're one of my bigger customers. So you're searching for sites to connect. As you see here, Mass General Brigham, they're listed as a hub. If I wanted to connect with them, I'd simply send them an invitation. Once they accept the connection, they'll appear under my contacts, and then I can go in and start requesting images, sharing images with them. A lot of times sites will list their preferred process or method for requesting images. So I'd say it's about a 50-50 split in my region for, if they want you to send them a fax, an email, or use the application. With the North Country, the beauty of the integration that we've done is none of this has to be performed. Sites can simply log in and start query retrieving the images. And that's similar to a health information exchange setup like the Indiana Health Information Exchange that I talked about. But most sites, as you're connecting, they'll want you to request through the application. You fill out the patient information here. You can actually attach the patient release here. It's just an electronic method to exchange and then receive the images once they're sent over. So once that request goes to the specific site, it's then on that site to fulfill that request. But you pull images into your images tab here. We actually have a third-party viewer, eUnity. It's clinical grade viewer. So here's an example of DICOM images. So images can be viewed within PowerShare, but a lot of times sites will take the images and actually have them pushed to PACS. And this can be automated as well. So when I say push to PACS, it's going to go from PowerShare through that accelerator software and into the respective organization's PACS. Because a lot of times, PACS admins, that's where they manage all their data for image exchange. So yes, it's in PowerShare. It stays there for 45 days. But the vast majority of sites will then take these images and push them into their actual PACS. The studies can be reconciled prior to doing this. They can be sent to a VNA where the reconciliation process occurs. It's really just dependent upon your organization's preference. But once again, with the North Country, this is all you don't have to request the studies. You just pull the images on demand, and it really has sped up the process, at least from my experience working with Samaritan, Claxton, Carthage, and I believe there's lots of other sites that are interested in this setup. River Hospital, it's starting out in the North Country, but it's my understanding there might be some plans to try to expand it more to the Rochester, Buffalo region as well. So that's just a brief overview of the application. Of course, there's messages that can be sent here. There's a HIPAA audit trail. So at any point in time, users can audit and see what's going on within the application for up to 3 years. And then we have our analytics function, which you can dive into and see, okay, who's driving most of our volume, where are those studies going? You can change the date range. This is a huge feature that a lot of our customers like, because they can actually get a visual representation of who's sending the studies where. You can actually see a breakdown of, okay, we're ingesting CDs still from these hospitals or these institutions. So that could be an opportunity for us to reach out to those sites and encourage them to either get on PowerShare or to start using a more of an electronic method through PowerShare. This is a good indicator to see, okay, this site may need to be set up with a PowerShare account. And these CDs are coming through PowerShare manually because we have our uploader. So let's say a patient presents themselves with a CD, your team logs in and uploads the images to yourself. That's where those studies are coming from. We can help eliminate that process, the CD process, by simply creating an account for them, which I can assist with doing, getting them on PowerShare as a spoke to start, connecting them to the hub, and then working with their team to install that accelerator software, get them acclimated, set up, and then you could begin growing organically through that hub and spoke model. So the key there is if there's a need identified, you're getting a lot of CDs or having trouble receiving images in a timely manner, that's when you'd reach out to someone like myself so I can work to set up and establish those accounts and grow as a hub, grow your network to connect. And that's how this all had come about. Up in the North Country, started with a hub site, started making connections. Then there was a need to grow, and then there was also a need to enable those cross-site query retrieves, which is a great business decision in my opinion. Just all the different CIOs and directors agreeing to electronic image exchange on demand, so that there's not as much of a need to manually request those studies, and really improves that process. So I know I've talked a lot. I've gone through a quick rundown. Are there any questions or anything specifically that I can address for anybody on this call?
If folks have questions, you can either drop them in the chat or raise a hand and I can unmute you.
Like people are waiting or raising their hand or typing their question. The one thing I actually forgot to do kind of at the end of my brief summary is that, if you are in a clinical setting and if you do any type of imaging, if you are not currently participating in our cooperative agreement and you would like to, we certainly welcome that. As Byron had already mentioned, our kind of 9 or 11 locations, I apologize, I don't remember off the top of my head. We've had great success with it. It's been a really good experience for everybody involved, both from the patient and the provider clinical side. So if anybody would like to join, we'd be willing to have that conversation. There is certainly a desire from our participants that we expand this out, specifically to some of the larger facilities, Buffalo, Rochester, Syracuse, Albany, etc., as well as getting over into the other stretches of New York. If you would find joining the network would be valuable, we would certainly welcome your participation in our cooperative agreement. So we'll put it in the chat, but you can reach out both to myself, Tom Zucker. I'm with Fort Regional Health. I don't think I did a great introduction to myself when I kicked off. So, or you can reach out to Joanna Loomis. I'll drop a chat message with both of our emails. And of course, you can always reach out to Byron as well. He's always a great resource, and obviously knows everybody connected, both from a hub and a spoke perspective, and can give you kind of all the details, and he can certainly make the connection with us too if you have interest in participating in the cooperative agreement.
Thanks, Tom. And I can also include your and Joanna's information in the follow-up notes as well. I think that's, a lot of great information that Byron just dropped, but it's certainly a lot. So if there's something that comes up to you after the fact, or if you have questions later, feel free to reach out to me and I can help facilitate a connection for that as well.
Yeah, absolutely. And I'm here to assist. So if you want to share my direct contact information, I'm happy to, go over PowerShare if people are interested. We'll get them set up. A lot of times they may actually have an account at their organization. It's just a matter of putting them in touch with the admins. So if there's any questions regarding PowerShare, this process, I'm happy to assist as well.
Great, thanks, Byron. I don't have any hands raised at the moment.
Okay.
So if there's anything else or anything to close us out, otherwise I'll give folks 14 minutes back in their day.
I actually got one question for Byron myself.
Great.
Sure.
I know we do obviously the cooperative agreement, but what is required to onboard patients? That is something that I know we haven't really kind of looked at. Is there, in order to give patients access to their own imaging, is that something we have to work with the different hubs, or what's that process look like?
Yeah, so patients can actually register for their own accounts at any point in time on PowerShare. Predominantly, it's started through the hub accounts. So I just like to use Samaritan since they were my first one. So we walk through the patient adoption process with them. And what's needed to set up a patient account is the patient name and an email address. We have a secure token feature as well, which is an additional layer of security. So it's very similar to connecting with another site, except it's purely for that patient account. So the patient requests images, they work through their compliance team to sign the releases, and then those sites, such as Samaritan, will invite the patients to connect to their hub account, and then they can begin exchanging and sharing images as needed.
Excellent. Thank you for clarifying that.
Yeah, no problem. Anything else I can clarify for the team?
I don't have anything else on my end.
Okay.
All right, so everybody feel free to look out for notes from me. And if you have any questions for Byron or Tom or the team, feel free to reach out to us. We'll make sure contact information is circulated. But we thank you for spending your time with us today on our July call, and our next call will be in September. So look out for that invite as well. And have a great rest of your day.
Okay, thank you.
All right, thanks all.
Thanks, everybody.